Hello and welcome to today's Talking Point presentation. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to elders past and present. I extend that respect to Aboriginal and Torres Strait Islander people listening today or in the future. My name is Rowan Ojal and I'm the Strategic Lead of the National Addiction and Mental Health Surveillance Unit at Turning Point and a Senior Research Fellow at Monash University. I'll be facilitating today's talking point entitled Using Law to Reduce the Cancer Burden of Alcohol, presented by Clare Slattery. Talking Point is a regular series of publicly available lectures that aim to inspire, inform, and challenge our notions of what we know about addiction and its impact across society. We like our webinars to be as interactive as possible, so please ask questions via the Q&A function, and these questions will be collated and answered by Clare at the end of the presentation. Our webinars are recorded and are later made available via the Turning Point website. So now I'd like to introduce today's presenter. Clare Slattery is a legal policy advisor at the McCabe Centre for Law and Cancer, the only centre in the world dedicated to using legal expertise to prevent cancer and protect those affected by it. Clare's work supports countries to adopt effective public health laws to prevent non-communicable diseases, defend those laws from legal challenge, and ensure policy coherence between health, human rights, trade and investment law. The McCabe Centre collaborates with individuals, organisations and governments to fight cancer and other diseases through its role as a WHO collaborating centre. Based in Melbourne, Clare has a background in public health, international law and legal research. Welcome, Clare.
Thanks, Rowan, and thanks for having me today. Before I start, I would also like to acknowledge the traditional custodians of the lands on which we meet today and pay my respects to the elders past and present and those emerging. I extend my respect to the Aboriginal and Torres Strait Islanders who are present today. Before I delve into the topic of alcohol and law, I first wanted to share a little bit about the McCabe Centre, where I've had the privilege of working for the last 8 years. For anyone online who doesn't know about the McCabe Centre, we are a joint initiative of the Union for International Cancer Control, Cancer Council Australia and Cancer Council Victoria. And we sit at Cancer Council Victoria's offices here in Melbourne. The McCabe Centre's mission is to use law in any way that we can to prevent and control cancer and other major NCDs, non-communicable diseases, I should say. And we take our name from Rolla McCabe. Rolla was a woman with terminal lung cancer who was one of the first people outside of the US to hold the tobacco company liable for their role in denying the harms from tobacco smoking. And today, the Centre's work has really evolved from Australia's experience being a world leader in tobacco control, and in particular in Australia's experience in implementing and defending tobacco plain packaging laws. For anyone who doesn't know, Australia was the first country in the world to introduce this world-leading measure of tobacco plain packaging, and we faced legal challenges both domestically and under international trade and investment law. While our work really evolved out of Australia's experience in tobacco plain packaging, today we focus across our work's a lot broader than just tobacco. To give you an understanding of the kinds of work the McCabe Centre works on, you can have a look at this slide. Our work is divided into 2 streams of work. We have a prevention stream and also treatment and supportive care stream. The treatment and supportive care team works across rights of people affected by cancer, the collection of health information, the regulation of health workforce, medical decision-making, and access to treatment. While the prevention team, which is where I am based, works across the World Health Organization's major non-communicable disease risk factors. These are on the slide and are tobacco, unhealthy diet, physical inactivity, air pollution, and the reason I'm here today, which is alcohol. So I promise I'm going to get into the topic very soon, but first I wanted to introduce you to my wonderful colleagues. We are an all-female team at the McCabe Centre, comprised of 8 lawyers and our wonderful communications manager. We are predominantly based in Melbourne, as I said, although we have got lawyers based in Kenya, the Philippines, and Samoa. Alcohol and law. Before we start into this topic, it's important, I think, to give a little bit of context. I saw this slide presented a few months ago at a conference, and I think it's a really good starting point when we think about alcohol regulation and how countries around the world in particular regulate this product. So on this slide, you can see that according to the World Health Organization, we have something like 2.5 billion people who consume alcohol. And when we compare this to something like a product like tobacco, we can see that we have a lot more consumers of alcohol than we have tobacco, and again, vastly more consuming alcohol than psychoactive drugs. I also like to put this in context though, because according to the World Health Organization in 2019, still more than half of the world's population, 56%, did not actually consume alcohol. So it's important to note that we have a lot of people who drink alcohol, but also a lot of people who don't drink alcohol. What's also important to note when we're talking about any conversation about alcohol and law is that when you consider alcohol compared to products like tobacco or other psychoactive drugs, alcohol is the only psychoactive substance with dependence-producing qualities and significant public health harm that is not governed at the international level by some kind of internationally legally binding treaty. I am not going to say that alcohol isn't covered by certain different international legally binding treaties. For example, alcohol is increasingly being considered a human rights priority and therefore falling under the coverage of human rights instruments, which are themselves legally binding. However, there is no one international treaty that focuses on alcohol. And in the area of work that I work in, I guess alcohol is most commonly compared to tobacco in this regard, where in tobacco we do have the WHO's Framework Convention on Tobacco. This is an internationally legally binding treaty that was adopted in 2003 and entered into force in 2005. So we don't have this in alcohol, but it is important to note that there has over the years been many, many different advocates and a couple of countries over the years who have tried to advocate that we should have something similar in alcohol. We don't, but it is important as we go on through the discussion today to note this. Another important thing before we talk about how countries regulate alcohol is to consider how much we actually drink. So today's conversation in presentation, I'm really going to be focusing a bit more on a global picture. However, it is important to note, as I think most people listening in today will be listening in from the Australian context. So in Australia, we drink a lot of alcohol. You can see this on the map. Australia is dark blue. We drink something, according to the WHO, which is 11.2 litres of pure alcohol per capita every year. Now, it's also important to note this is well above the global average, which is 5 litres of pure alcohol. Why should we regulate alcohol? Well, worldwide, according to the World Health Organization, alcohol results in 2.6 million deaths every year. Of these, the vast majority are from noncommunicable diseases, including 400 of these from cancer alone. We also know that an estimated 400 million people, or 7% of the world's population aged 15 and over, live with an alcohol use disorder, including 209 million with alcohol dependence. In the Australian context, we know that in 2023, there were 1,667 alcohol-induced deaths, and a few years prior, 1,900 alcohol-related injuries. But to explore some of these health risks in a little bit more detail, according to the WHO, alcohol is associated with more than 200 different diseases and injuries, and you can see some of these, you can see these on the slide here. The green indicates the injuries and conditions where alcohol has a detrimental health impact. So here you can see alcohol's relationship with communicable diseases such as tuberculosis, HIV/AIDS, and sexually transmitted diseases. Alcohol plays an important and crucial role in a number of different kinds of injuries, including both unintentional injuries. We know that alcohol is a major contributor to many road traffic accidents, but also intentional injuries, including suicide. and where my work focuses in particular, which is the relationship between alcohol and non-communicable diseases, and in particular cancer, which we'll focus on in the next coming slides. However, it is important to note in terms of regulation of alcohol that one of the major challenges for alcohol has really been this yellow bit on the slide. There are some beneficial aspects of alcohol consumption. These are recognized by the World Health Organization when alcohol is consumed at low levels. So it is important to note that a heavy episodic drinking has no health benefits, but there are definitely some health benefits associated with lower alcohol consumption for diabetes and cardiovascular diseases. So where I, however, am particularly focused is the relationship between alcohol and cancer. So we know that from 1988, in 1988, the International Agency for Research on Cancer first classified alcohol as a Group 1 carcinogen. This is the highest group level and places alcohol along. We know that alcohol is linked to at least 7 different types of cancer, including the most common types of cancer we have in Australia, including that there is no safe level of alcohol consumption for cancer. So while we've known since 1988 that alcohol is linked to cancer, there's been a really big push in the last 10 years to really focus on the relationship between these potential benefits and these negative health harms from alcohol consumption. And this was a really crucial piece of research that was released in 2018, which concluded that with the conclusions that alcohol is a colossal global health issue and small reductions in health-related harms at low levels of alcohol intake are outweighed by the increased risk of other health-related harms, including cancer. So essentially, regardless of any potential beneficial aspects of alcohol, we know that the cancer risk will outweigh all of these. According to the World Health Organization, to identify a safe level of alcohol consumption, valid scientific evidence would need to demonstrate that at and below a certain level, there is no risk of illness or injury associated with alcohol consumption. Currently available evidence cannot indicate the existence of a threshold at which the carcinogenic effects of alcohol switch on and start to manifest in the human body. Moreover, there are no studies that will demonstrate cancer, and you can see the breakdown on this slide. So this turns to our focus of the conversation today, which is how do we regulate alcohol? And we've talked about these health harms as justification for why countries regulate alcohol. But, and I'm going to give you a bit of I'm going to shoot to the end result, which is we know exactly how we should regulate alcohol. We know the different types of laws that really work. But I think it's really important for the conversation to recognize that when it comes to alcohol, there are many different social, economic, and cultural reasons for why countries choose to regulate alcohol, or how they choose to regulate alcohol, or whether they choose to leave it unregulated. And there's also in many countries around the world religious reasons as well. We have, for example, a number of Muslim majority countries where alcohol is prohibited. So while we know exactly what we should do with alcohol, there are many different factors that come into play in a country's decision to regulate alcohol. Internationally, we have adopted a number of different targets on alcohol, and these are 2 of the most important. So by 2030, and this aligns with the Sustainable Development Agenda and WHO's agenda on non-communicable diseases, we reckon we are trying to achieve at least a 20% relative reduction in the comparison with 2010 levels in the harmful use of alcohol. Now, when I first actually went to make this slide, I just assumed that we were definitely not going to be on track. But I was actually pleasantly surprised to note that the most recent data released in this year, 2025, indicates that we actually currently are on track to reach this goal. And this is really about a per capita decline in alcohol consumption. So that's really promising news. However, the second indicator is definitely a little less promising. So by 2030, 70% of countries have introduced, enacted, or maintained the implementation of high impact policy options and interventions on alcohol. Now, I'm going to talk about these high impact policy options and interventions soon because we know exactly what they are. I couldn't find the exact data on how many countries have these policies in place, but I do know that this has been uneven. Many countries in the world have regulations on the availability of alcohol, for example. We have lots of licensing systems around the world. However, we know other areas of alcohol regulations, such as alcohol marketing, very few countries have regulations in place, leaving this tends to be left to self-regulation from the industry. So it's very much uneven progress in terms of where we are around the world with alcohol regulation. So how to regulate alcohol? As I said, we know exactly what we need to do, and that is because WHO instruments have told us and recommend exactly what needs to happen. WHO, as the main international body working on alcohol, has adopted over the years many important instruments on alcohol. And you can see a number of these, the most important ones on the slide here. Now, I do want to come back to what I noted earlier in this presentation, that one thing to note about all of these instruments on this slide is that these are not legally binding documents. These are what we would call in law, not soft law instruments. They are very important guidance, and then they also represent very important commitments that countries like Australia have made on alcohol in different international forums like the World Health Organization. However, they are not legally binding, and that is important to contrast with respect to like tobacco, where we have got an internationally legally binding treaty. However, as I said, it's really important to note these are very important documents, and because they're not legally binding doesn't mean they are any less important. And these do represent and do dictate how a lot of countries implement domestic alcohol policy. However, I do have to say there has been a number of decades worth of advocacy for something similar that we have in tobacco, in alcohol. And so often that's called a framework convention on alcohol control. This has happened and been around for about 2 decades. However, at present, we do not have a framework convention on alcohol control. And it remains to be seen whether we will in the future. WHO's main instrument on alcohol is the WHO Global Strategy to Reduce the Harmful Use of Alcohol. Now, this strategy was adopted by the World Health Assembly, which is the governing body of the World Health Organization, in 2010. And of importance for our conversation today, it lists 10 areas that governments really should act. You can see these on the slide here. So these are leadership, awareness and commitment, health services response, community action, drink driving policies and countermeasures, the availability of alcohol, marketing of alcoholic beverages, pricing policies, reducing the negative consequences of drinking and alcohol intoxication, reducing the public health impact of illicit alcohol and informally produced alcohol, and monitoring and surveillance. Now, it may be obvious why I bolded some of these, but the ones that I've bolded in particular are really areas where it's really crucial to use the law to implement these policies. Law is also important to a number of the other aspects, but it's these ones in bold that I'm really going to be focusing on, in particular the bottom 3 as well. And you will see time and time again, these are the policies that WHO recommends countries introduce. So in the lead up to the 10-year anniversary of the Global Alcohol Strategy, WHO set about deciding what was going to happen next. It was really in appreciation that there had been really unequal implementation of the Global Alcohol Strategy, that there remained to be really high levels of alcohol consumption per capita and to much health harm from alcohol around the world. And so they really set about figuring out the next steps. And this is where we see the strongest calls of late for some kind of internationally legally binding treaty on alcohol, with the idea here really trying to leverage the success that advocates in alcohol see happening in tobacco from having an internationally legally binding treaty. Now, this didn't happen. What resulted was the adoption of a global alcohol action plan for the period 2022 to 2030. And for the purposes of today's discussion, this action plan really zoned from those 10 areas of national action to 6 areas. And it's really about strengthening and implementation of that initial global alcohol strategy in these 6 areas of global action. I'm just going to be focusing on number 1, which is the implementation of high impact strategies and interventions. So again, in the Global Action Plan, we see member states being recommended to implement as appropriate in national context. So this is WHO recognizing that every country is different and every country will have those cultural, social, and economic reasons for why and how they regulate alcohol. But still recommending that countries introduce high impact and effective strategies and interventions supported by legislative measures, recognition that law is really important in this space. So these policies should address the affordability of alcoholic beverages by appropriate taxation and pricing policies, the advertising and marketing of alcoholic beverages through comprehensive and robust restrictions or bans across multiple types of media, including digital media, the availability of alcohol, driving under the influence of alcohol by enacting and enforcing drink driving laws and regulations, and hazardous patterns of drinking and alcohol use disorders, by providing brief psychosocial interventions, treatment and care in health and social services. Now, I hope I'm starting to really repeat myself because these are the interventions WHO has time and time again recommended countries introduce for alcohol. Where do these interventions get their justification, I guess you could say, is that they are WHO best by interventions. So one important aspect of WHO's work on alcohol has been the inclusion of alcohol in WHO's non-communicable disease agenda. So WHO recognizes that alcohol is one of 5 major non-communicable disease risk factors. And as such, it includes a list of policy. They have a list of policy options, which they call WHO best buys and other recommended interventions for the prevention and control of non-communicable diseases. So these are the policies WHO recommends that countries introduce to combat these risk factors, such as alcohol. Now, this instrument divides policies into 3 different types of policies. We have best by policies. These are the interventions that WHO recognizes are evidence-based measures, but also very cost-effective measures. They are the most cost-effective for countries to introduce. For alcohol, there are 3, and I'm going to turn to them very, very soon, but they will not be a surprise to you if you've been listening. We also have some good buys in alcohol. These are effective interventions where WHO recommends as cost-effective analysis, but that is not quite as cost-effective as the best buy interventions. And finally, WHO also has other recommended interventions. These are interventions where we know that they work, the evidence-based interventions, but they do not have a cost-effective analysis available. Now, WHO's best buys are a living document, which means WHO does regularly update this document as new measures come to light and as evidence emerges that measures work and on their cost effectiveness as well. So as I mentioned, and I hope you've been listening because this is where we see again, these are the best buys for alcohol. These are the measures that WHO recognizes as evidence-based measures that are also cost-effective. So we have increasing excise taxes on alcoholic beverages, enacting and enforcing bans or comprehensive restrictions on exposure to alcohol advertising across multiple types of media, and enacting and enforcing restrictions on the physical availability of retailed alcohol via reduced hours of sale. We have the good buys, so these are measures which are not quite as cost effective as the best buys, but we can see here drink driving laws and brief psychosocial interventions. Now, what I hope you will see in particular with the 3 best buys, but also obviously drink driving laws, these are all measures that we know that the law is incredibly important to implement these measures. While countries around the world do regularly introduce, for example, marketing restrictions via self-regulation without using government-mandated legislation, we know that time and time again, these measures are proven to be ineffective. Self-regulation is consistently found to be an ineffective way to introduce comprehensive alcohol advertising measures. Just to take a quick, brief snapshot to detour to show you where Australia sits in terms of implementing WHO's best buys on alcohol. So Australia, as a member of the World Health Organization, regularly reports on things like the implementation of the best buys. This data here is from survey results that the Australian government has provided. So the Australian government has answered this in 2023, and that was published earlier this year in 2025. So according to the Australian government, we do have partial restrictions on physical availability. That's not a surprise. We have got liquor licensing in Australia. For example, we see that alcohol is not sold in supermarkets as it is in some other parts of the world. What is sad but not a surprise is that alcohol advertising or comprehensive restrictions are not present in Australia. So we have self-regulatory measures for alcohol advertising in Australia, which is very common around the world, but unfortunately we're not on track with that Best Buy. And finally, the Australian government does consider that we have fully achieved increasing excise taxes. This is an interesting one to me. So it's not an area that I'm 100% across, but this indicator asks countries to indicate whether they have excise taxes on wine, spirits, and beer, and also whether they adjust that for inflation. While those things are true, Australia, as a major wine producing country, and it's not uncommon for wine producing countries to do this, we do tax wine differently to other alcohol with our wine equalisation tax. So that's just more of a query than necessarily saying that that is wrong. So I'm going to delve in also to other recommended interventions. As I said, WHO have these Best Buy and Goodbye recommendations, but they also recommend a number of other interventions that countries should consider adopting as part of comprehensive alcohol laws. So these are interventions for which there's no cost-effective analysis, but we know that they are evidence-based and they work. So these are all incredibly important. I'm just going to highlight one today. And it's not because that's any more important than the others, but it's an area that I've been working across a lot in the last few years. And it's something that we see more and more countries working on. And that is providing consumers with information, including labels and health warnings about content of alcoholic beverages and the harms associated with alcohol consumption. And in part of this case study, I'm really going to be focusing on the idea of health warning labels. So there's also a lot of important work going on in providing other kinds of content on alcohol labeling, but today I'm really just focusing on health warning labels as one component of that. So around the world, current alcohol labeling practices are not standardized. In 2019, just under 40% of countries reported having at least one alcohol health warning on alcoholic beverages. So this means that around 3 billion people in different countries around the world don't see any kind of health warning when drinking alcohol. Now, this picture on the slide, I'm not 100% ever sure of its accuracy given the cancer warning. Here it says the number of countries see cancer warnings. I'll come to this in a second. But as far as I'm aware, there is only 2 countries in the world that have got a requirement to have a cancer warning. So why are health warnings important? We know that there's really low awareness in the general population about the links between alcohol and health harms. And this is particularly clear when it comes to the relationship between alcohol and cancer. According to Alcohol Change Australia, only 14% of Australians are aware that alcohol can lead to breast cancer, one of our most common cancers in Australia. And just a third know that it causes cancers of the mouth and throat, and knowledge of the link between alcohol and cancer is low among certain groups, in particular among men, young Australians, and people living in regional areas, and people in lower income households. And it's really for this reason that the World Health Organization recommends that countries introduce alcohol health warning labels. And it's not about making people or making people stop drinking. It's really about giving consumers the information that they need to make an informed decision. And the reason that I have been following this a lot lately is that Ireland has introduced the world's first comprehensive health warning label. And in particular, for someone working in the cancer space, what's particularly exciting is that it includes a link to cancer. So you can see the Irish labels on the top. So the Irish label that they've introduced is the one that's sort of in the black square. And then down the bottom, you can see that some alcohol companies have actually started putting this label on their alcohol brands sold in Ireland. Now, it's really important to note that Ireland has introduced this alcohol labelling measure as part of comprehensive alcohol laws. So we recognise that there is no silver bullet when it comes to alcohol regulation. There's not one measure that's going to successfully reduce all alcohol-related harm. So Ireland has introduced in 2018 the Alcohol Public Health Act. And in this act, they've introduced minimum pricing, alcohol advertising provisions, as well as alcohol availability provisions as well. The alcohol labelling regulation, the alcohol labelling laws were implemented via Ministry of Health regulations in 2023, and these regulations gave the alcohol industry a 3-year period to implement this measure. And that required the alcohol industry from May of next year to have this warning on place. Now, unfortunately, devastating circumstance, last week Ireland has in fact decided to delay this measure, and as a result, this measure is not going to come in effect for another 2 years. I'm still very confident that Ireland will in fact introduce this measure, and we will talk about one of the reasons why Ireland has delayed it very shortly. But what is really important about Ireland's measure is that Ireland's label will be the very first of any country in the world that has a link between any level of alcohol consumption and cancer for every single alcoholic beverage sold in Ireland. Now, there is one other country that we are aware of, and as I said before, there are a few other countries that do note that they have cancer warning labels, but there's no English available translation, so it is very hard to know anything more about those laws. But South Korea does also require a cancer warning label. In South Korea, alcohol industry are required to choose between one of 3 different rotating warnings, with 2 of these warnings are linking between the relationship between excessive alcohol consumption and alcohol drinking. So, and cancer. So we know that South Korea does have this law. However, Ireland's legislation takes it a little bit further in that it would be required on every single prepackaged alcohol bottle, but also it says that there is a direct link between any alcohol consumption, not just excessive alcohol consumption. Okay, so challenges for alcohol regulation. I said that Ireland's regulations for our cancer warning labels have now been delayed by 2 years, and this really represents one of the major challenges for alcohol regulation, which is the alcohol industry. So I'm sure it will come as no surprise that the alcohol industry is incredibly powerful. So this is a map from a few years ago, but I'm sure it's still roughly accurate. And it shows that the world's 10 largest producers of alcohol produce all of this, most of the world's alcohol. We can see all the different brands that are attributed to these major alcohol companies. Now, we know that in 2018, that the annual sales for the largest alcohol company in the world was something like $56 billion US dollars. An area that we do a lot of work in is the Pacific, and a lot of Pacific countries have annual GDPs of roughly $5 or below billion dollars. So we can see that the power dynamics between some countries can be significant, with the alcohol industry having significant power in an ability to delay effective public health legislation. And this is unfortunately what has happened in the Irish context. So a few things that are really important to note is that in the process of developing Ireland's alcohol labels, they made a number of concessions to the industry. They initially they initially allowed a 3-year implementation period. This was to give industry a long period to put the labels on, but they also allowed this measure to be adopted via a sticker. This is quite a common way that countries sort of manage the cost to industry so that they don't have to be required to printing new labels. They were allowing this warning label to be put on via a sticker. Now, the other important thing to note with Ireland's label is that this was a measure that only applied to alcohol sold in Ireland. It was not going to be required on exports, and therefore what has happened in the last few weeks has been particularly devastating, because in response to Donald Trump tariffs being placed on Ireland, this was one of the justifications Ireland has used to delay this measure. So this is a response that we've seen from the Drinks Ireland, which represents the alcohol drinks industry, and we've seen them really coming out and welcoming this announcement of the delay of Ireland's alcohol labelling measure. And they've said that highlighting the difficulties the Irish drink sector has faced this year, they've really welcomed this announcement. The US represents the most important export market, with products such as Irish whiskey particularly affected by tariffs and ongoing trade uncertainty. On top of that, new labelling legislation will have increased packaging and labelling costs by some 35%, says the association. Yet we also know that that doesn't quite line up with what we know, which is that this measure would not have affected trade, because it wouldn't have been required on products sent to the US. It also wouldn't have increased costs as substantially as you would expect, given it was allowed on the sticker. Now, Alcohol Action Ireland, which is one of the major NGOs working on advocating for this labelling measure in Ireland, came out with this last week, which was alcohol industry using every dirty trick in the playbook to muddy the water around labelling. Now, we know, because we know the alcohol industry likes to use the same tactics in any country. They'll use similar measures and tactics, and they like to delay and deter effective public health labelling. If you want to read more about it, you can see this WHO European region resource, which was put out earlier this year or last year, I can't remember, on empowering public health advocates to navigate alcohol policy challenges. And this is really about sharing the stories about the common sort of arguments and tactics the alcohol industry likes to use to sort of delay and deter public health legislation. And these lessons, I can guarantee, extend beyond the European region and the common across all countries in the world where the alcohol industry operates. And unfortunately, we're definitely not immune from commercial influence in health warning labels in Australia. So one of the successes that we have in Australia and New Zealand is that we now have got mandatory pregnancy warning labels required on all alcohol sold in Australia and New Zealand since 1st of August 2023, and you can see the top label, the one with the sort of black border, is what we now require on alcohol in Australia and New Zealand. This is a massive success story. However, it did come, it was a very long success story. It took decades of advocacy, and the alcohol industry in Australia, using their own self-regulatory labelling measure, which you can see below, the DrinkWise one below on the slide, unfortunately did delay the implementation of the government mandatory pregnancy warning label. And we also do know that there is suggestions that this also, the mandatory labelling measure is not quite being fully implemented yet as well. But I'm going to leave it there. And I'm looking forward to hearing any questions.
Wonderful. Thank you so much, Claire, for a wonderful presentation, and also a look around some different countries as well, and how they regulate alcohol. We've had a series of questions asked in the Q&A forum, and I can ask other people who've joined today's webinar, if you've got a burning question, please include it in that Q&A forum. We've got a little bit of time, Claire, so I've actually grouped questions according to theme, and thought we could start talking through some of these. So the first few questions relate to efficacy. So I'm going to ask you that, often when laws are proposed to control alcohol or other substances, people may argue that it will just drive the behaviour underground and it won't actually make a difference. What are your thoughts on that?
So are you sort of here referring to like illicit alcohol, or you think the questions are
Yeah, sure. Or in general, that, in response to, I guess, any legal change, that could be the outcome.
Yeah, I think these are kinds of arguments that we see actually being put forward by the alcohol industry themselves. And I think when we think about a lot of alcohol regulation and what it's actually trying to achieve, which is reducing alcohol harm, but it's also about leveling the playing field a little bit. And I think what a lot of a lot of people don't really see is that the alcohol industry spends billions and billions of dollars every year in marketing and ensuring their products are visible and well seen and part of the cultural identity of countries around the world. And therefore, regulation, I guess, is trying to put it a little bit more on equal playing field, so that when you do decide to drink, or you want to consume alcohol, you're doing so on a little bit more of an equal playing field with a little bit more information, rather than information coming entirely from the alcohol industry. And in terms of any other broader consequences of regulation, there is importance whenever we're creating laws that we do so incorporating, a wide whole of government, sort of whole of society approach. It's really important that we're thinking about how laws can be implemented, but also enforced as well, so that we are making sure that we are, protecting potential risks of illicit alcohol and those kinds of measures as well. So it's about a whole of society, whole of government kind of approach. But I do think that one of the importance of alcohol regulation is about leveling the playing field a little bit. It's not about making people not drink or taking away alcohol. It's really about reducing the power dynamics a little bit in favor of the consumer.
Thank you. Continuing, I guess, on the theme of efficacy, I'm glad to see you showed the Australian example and the move from the drink wise to the government mandated message. Can you comment more broadly on, what types of warning labels or features thereof are effective, and do they actually result in behaviour change?
It's a good question. Yes, so look, there's lots of evidence and still emerging, but I guess in terms of what countries around the world are putting on their alcohol labels, we're seeing more and more countries putting pregnancy warning labels, which is incredibly important. Obviously, we know from the Australian experience, but we're also seeing lots about drink driving, underage drinking, excessive drinking. We are seeing more and more about other kinds of health harms. So, the risk of liver disease, you can see also on the Irish cancer warning, the Irish labels, and then cancer as well. In terms of the evidence, I think the evidence base for labeling measures is very much emerging. It's definitely strengthening. It is important to note, however, that it is still emerging in terms of the evidence, but the alcohol industry themselves also has a role in playing in deterring evidence as well. We see in Canada, there was an alcohol a labeling study that was deterred by the threat of litigation from the Canadian government, from the alcohol industry to the Canadian government. So, the evidence is there, I think, but it's also still emerging on different types of how alcohol labeling works, the different types of warning. There's a lot of evidence about all the different words that you put on the label, how it refers to the risk of, for example, cancer and alcohol. And so that's where we see, that it's very important that this evidence sort of keeps going and keeps coming.
Thank you. During the talk, you highlighted physical availability as one of the WHO Best Buy measures. How does home delivery, and in particular the rapid home delivery that we've seen grow, affect this measure?
Yes, I think it's this is a point that I think many jurisdictions in the world are currently dealing with. I think that during COVID, we saw this rapid expansion of the availability of alcohol in our homes, and that caused all kinds of challenges, from verification, from access, to having this product just widely available. And I think jurisdictions are struggling. I think a lot of legal systems simply don't cover it. Or if they do cover it, it's very not yet comprehensively covered. So I think it's something that jurisdictions are working on. I know there's some countries that have started introducing laws on it, but I think it's an area that the alcohol industry has moved faster than the legal landscape.
Yes, I definitely agree. All right, we're going to switch topic now and talk about the regulation of other products. What laws regulate or are needed to regulate, homemade alcohol-containing products?
This is an interesting question. I will have to say, it's not something that I am across, to be honest. Yeah, no, I think it's not something that I would feel comfortable commenting on, other than to say that we do, I think, in a lot of countries, have quite good laws on how alcohol is made. But yeah, it's not something, unfortunately, I'm across. It's an important area, but not something I feel comfortable commenting on.
No worries. We have super engaged audience, so a lot of these questions are going to come. I guess in a related kind of question, do you have any comment on the regulation of no or low alcohol products? Is this something that we need to take notice of?
Yes, so I definitely think this is an area that we need to be watching. I think that there's definitely some arguments that there's some beneficial aspects of having these low and no alcohol products, especially for people who may want to stop drinking or have an alcohol-free day. I know, as someone who spent the better half of the last 5 years sort of being pregnant, I love the idea of having a drink that, people always assume that, if you're not drinking, you're pregnant, or, it's great having that option for people. But I do think at the same time, there's a number of challenges that we have to think about with these products. And I think in particular, the marketing of these products is an area that we're seeing really start, it's really important that we start to watch. These are products that now in many supermarkets are sold right next to soft drinks. We know that some of these products are sold and marketed by major companies that simply now say, for example, Heineken 0.0, but now we have a Heineken in a store and a product and area that we never had Heineken advertising before. We have the access of children and emerging evidence in terms of the relationship that children see and when they see these products and how that relates to how their decisions to drink alcohol in the future, but also we just have these products in situations that we've never had before. We have zero alcohol, alcohol 0.0 at sporting events and, kids sporting events or in the fridge at home when kids are seeing them. So I think there's a lot of areas we see countries starting to grapple with it. But I think this is an area where we have to realize the industry is moving very fast. And I don't want to criticize the law because I think the law is incredibly powerful, but law can take time to catch up. I think it's an area where we need more and more research and evidence, and we need the law to sort of work at very fast speed because countries around the world are grappling with this. And I think it's a little bit, in some regards, it can be sort of compared to what we see happening in e-cigarettes and vaping in relation to tobacco control. Again, an industry that's moving really fast, and countries are really struggling to regulate this product because we know the health harms are there. So the health risks, I think, from low alcohol products are really this risk of youth consumption and exposure to a product more widely than we previously had.
Yes, definitely. And in your answer there, you talked a little bit about marketing. Do you have any thoughts or ideas on how to address social media marketing and the use of AI targeting of alcohol-related ads to individuals or group of individuals? What's the role of regulation here?
Comprehensive. I think there's no one such perfect policy when it comes to alcohol regulation, but I think in an area like marketing, it's really the comprehensive nature, and it may be not just one tool. It might be requiring lots of different kinds of legal tools like privacy law, competition law. There's many different areas of law we might need to use and be creative, but I think it's about trying to almost be in front of those new developments, making sure that we're drafting laws that capture things that we haven't really thought about, and making sure that we are protecting, in particular, those children who shouldn't be exposed to marketing. But it's an area that we are struggling. Countries around the world are struggling to grapple with, but they're starting to be some great developments.
Sure. The next series of questions really I've grouped under a kind of a broad header of community support. So maybe starting with this one, what is the level of support for increased alcohol regulations in Australia, and does that differ to communities overseas?
Can you just repeat that question?
Sure. So the question is about what the level of community support is for increased alcohol regulations in Australia, and whether that level of support is the same or different to overseas.
Okay, so I think in terms of community support, I think generally the community, I can't quote exact studies, but I think generally there's quite a lot of community support. But I guess it's more about that political willpower when it comes to countries deciding to regulate alcohol. So, and I guess, the more that community support rises, I guess that will change community political power as well, political support. I think it is important when you think about countries around the world who decide to regulate alcohol. It can be a challenge depending on the composition of the country. So, for example, Ireland has taken this world-leading alcohol control laws. They are also, however, a producer of a lot of alcohol. It's not uncommon for countries who do produce a lot of alcohol to, I guess, regulated a little bit more relaxed. I guess one thing that you will see, Ireland has, for example, faced a lot of challenges from other countries who are alcohol exporting countries like Australia over the introduction of alcohol warning labels. So that's not uncommon again. So in terms of what we have in support for alcohol regulation in Australia, I would say it's not high, but I think that can always change.
That's fair. Well, I have a question here, I guess, that brings us back to the Australian context, that the alcohol industry is involved or sponsors, sporting teams, events, or codes. So, how can the cancer link message be best heard and understood given that context?
Yeah, so in terms of yeah, I mean, alcohol industry and alcohol sponsorship of the sports, that's a big area. That's an area that it would be great to have more regulation on. That's an area that countries are starting to sort of move on. I think when it comes to the alcohol industry interference in different kinds of policies and public health policies in particular, we do see negative, that often results in negative sort of public health benefits when the alcohol industry has got strong political power. I guess that's one of the lessons that countries do tend to take from tobacco control, where we have much stronger provisions in terms of the engagement with tobacco industry and public health policies. So we don't have something similar in alcohol, but it's very much an area where it's always important that governments are protecting public health policies from that commercial influence, which often comes at focusing on more profit maximization rather than protecting public health.
Yes. I was also interested during the talk that you introduced South Korea as another country that has introduced labels. And we have a question from the online audience that are the looks of health warning labels being rotated in Australia, or is that something that is being considered to prevent people being desensitized to either the message or the look of those labels?
Can you just repeat that question again? Sorry, about the rotating.
Yeah, so you mentioned in your talk that South Korea rotates, I think you said, between three different messages. Are the looks of health warning labels rotated in Australia, or is that being considered in any current policy?
Yes, I think so. Yeah, so South Korea has an option. They don't rotate. They ask industry to choose between one of three. Three of different, so the industry themselves gets to choose. I know other countries, like for example, Thailand in the past has proposed their own graphic health warnings for alcohol, which would be a rotating sort of warning like you've seen in Australia, where we have for tobacco, we have graphic health warnings which are rotated. I know there's a lot of evidence about that rotating aspect in terms of sensitization. In terms of Australia, like obviously for alcohol, we only have one pregnancy warning label that's not rotated. In terms of countries that are proposing alcohol labeling, I think it's just Thailand that's ever had the idea of proposing, to rotate. They had graphic health warning proposals that they're not currently working on anymore. South Korea, I don't believe they rotate them. They just ask industry to choose. And as far as I'm aware, the industry tends to just choose the warning that doesn't mention cancer. But I obviously don't I don't read Korean, so I don't speak Korean, so I can't confirm that. So yes, that's just sort of anecdotal comments.
Sure, sure. So I guess, the follow-up there is, what's actually needed for Australia to adopt a cancer warning label?
That's an interesting question. Yeah, so I think when it comes to something like a cancer warning label in Australia, there'd be a big jump from going from like a pregnancy warning to then having a cancer warning. I would love to see it; it would be wonderful. But I think when we think about cancer warning labels, what's happening in Ireland at the moment will be really important in terms of other countries introducing this measure. We know from the Australian experience with tobacco plain packaging, obviously it's a different risk factor, but we know that when we introduce this really world-leading policy, for anyone who doesn't know, tobacco plain packaging is the policy which requires all tobacco in Australia to be sold in those sort of black, brown covers without any promotions or brands advertising. So this was a really world-leading policy, but we also know that other countries sort of waited until the Australian government had successfully defended legal challenges. And this took a number of years for the Australian government to do. It was very committed to this policy measure, and we successfully did defend this policy. And we know that after Australia successfully defended it, many other countries then sort of started implementing their own plain packaging laws. So I think when it comes to cancer warning labels, what's happening in Ireland right now is incredibly important, because once Ireland has these labels enforced, they are enforced, they're just implemented on actual alcohol labels. I think we'll see that other countries starting to really introduce their own version of cancer warning labels. I would love to see it happen before that. However, I think that often countries will wait to see what happens from industry. So the alcohol industry in Ireland has been very strong opposed to these alcohol labels. And we've also seen Ireland face significant challenges at the World Trade Organization from other alcohol exporting countries, like I said, like Australia. Although Australia has now dropped our concerns, which is really good. I mean, I'm not saying Australia couldn't have a cancer warning label soon, but I think it's really watching what happens in this space with other countries, because they do, industry uses the idea of a threat of legal challenge or industry concerns to sort of almost delay other countries introducing these kinds of measures as well, because they get nervous about, having to defend it if they were also challenged from the industry.
Wonderful. Thanks for being so patient with all the questions. I'm going to finish with just one final one, which an audience member has termed a devil's advocate kind of question, and it's got a little background. So pricing in Australia, notably in different settings, has already seemed to have driven away some younger consumers of alcohol and driven down overall consumption. And also the need to equate it with every social occasion. So is there just a time will tell effect where generational change will occur and we're going to see a reduction in alcohol harms without even doing anything?
Look, I would love to say we could not do anything and alcohol will reduce. I think, the comment is accurate. We are seeing alcohol consumption decline, I think, around the world. That's really great. However, I actually think there's certain demographics. So, for example, women of a certain age are increasing. We also know older people in general are increasing alcohol consumption. I think it would be naive to say that the alcohol consumption declines aren't because there's been consistent alcohol advocacy. There has been a lot of work in the last 20, 30 years on alcohol, even though we don't have super strong laws. I think around the world, we have some, and we have had concerted effort to reduce alcohol consumption. So I think, we actually have been doing, there's been a lot happening on alcohol that has reduced alcohol consumption. And I think, consistent laws are really important. I also think that it's naive to think that the alcohol industry is going to let their product no longer be profitable. So they are going into markets like no and low alcohol brands. These are products that still have health harms as well. They're not water. They've got other products in them that contribute to things like overweight and obesity. So I think it's naive to let the alcohol industry pick another product that we also don't know about the health harms from as well. I think the alcohol industry is driven by profit. I think they will not sit around and let every Australian not drink alcohol. They still sponsor and put a lot of money into marketing because they presumably still want people to drink their product. So I think that we need really important laws. I think we need comprehensive laws so that people can make a decision about alcohol. And I think in Australia we have pregnancy warning labels now, which is fantastic. I think it's a really great start, and I'd love to see that extended beyond just a pregnancy warning.
Thank you, Claire. I think that's a really strong point to finish on. And I want to thank everyone who attended this webinar and particularly who asked a question of Claire. And I really thank you for the discussion element at the end. I think we covered many different topics and enhanced the presentation that you gave today. So being mindful of time, I want to thank everyone for attending. And thank you so much, Claire, for coming along to Talking Point.